This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
No words can explain the joy a baby brings. This is exactly how first-time mom Ginger Arboleda felt when she gave birth to baby Zika.
Nothing compares to seeing your daughter for the first time. It's really a joyful feeling. We were very relieved at the same time, so happy to really have seen her for the first time.
With Ginger's overflowing happiness comes fear of not being fully prepared for her new baby.
I was scared of not having milk. I was scared that if something would go wrong, like if she had allergies or if she had like mga rashes, was it because of me? Was it because of my milk? Or if she wasn't really sleeping, lalo na the first 3 nights, was it because we were doing something wrong? Mali ba yung the way we were holding her?
Having a baby entails a lot of responsibility.
We advise for new mothers to have first a prenatal check with their OB, of course, when they're pregnant, and also to attend some breastfeeding prenatal classes for them, just so they know a little bit on what to expect when they give birth.
For Ginger, being a mother is life's best gift to her. She would do anything to give her baby only the best.
As a mom, you will never stop learning. So you learn from the experiences that this new chapter of your life brings you. So what you can do is make the most out of it.
Well, actually, if you have a calm mom, then you have a calm baby. So first thing, what we usually tell our mothers is they have to be knowledgeable, they have to know, and they have to be prepared for the birth of their newborn so they can care for them.
What are the things an expecting mom should consider during pregnancy? What should a new mother do upon giving birth? What new practices can help the mother in taking good care of her baby? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Marilyn David Ruaro, obstetrician and gynecologist from the Manila Doctors Hospital. Also with us is Dr. Cynthia Cuayo Huico, pediatrician from the Manila Doctors Hospital, Cardinal Santos Medical Center, and the Medical City. You can participate in our discussion by calling our hotline. You can also follow us on Twitter, post on our Facebook page, or send us an email. Doctors, good evening. Welcome to the show.
Good evening. Good evening.
Tonight, it's all about mommy and baby care. But before we can talk about caring for our babies, we first have to take care of ourselves. And while we're pregnant, there are some measures or some things that we have to keep in mind so that we have a happy and healthy pregnancy. So how do we do this? How do expecting moms or expectant moms take care of themselves and their babies during pregnancy? Dr. Ruaro?
It all starts with prenatal care, I suppose. And this is a program by which we monitor the health of the pregnancy. And this is intended to produce or have the outcome of safe delivery, as well as a healthy mother and baby. I want to expand this because we've always had the idea that prenatal care is between the doctor and the patient. I would like to say na dapat po ang prenatal care mas malawak, kasama ang pamilya, lalo na ang mahal sa buhay. Kasi para makasunod ang pasyente sa advice ng doctor, kailangan niya ang support ng family. The other thing na gusto kong i-expand about prenatal care is the new concept of preconception care. Which means that we want to take care of the woman, even before she is pregnant. So bago po kayo magbuntis, nagpaplano pa lang kayo, namamanhikan pa lang ang boyfriend, kailangan nag-iisip na tayo ng preconception visit to your favored doctor. Also, kailangan ng prenatal care is effective. That means regular siya. That means pinakamaagang pwedeng gawin sa pagbubuntis. And also, dapat interactive. Meaning to say, the doctor should be able to answer the questions, and the patient should also know what questions to ask. So, yun ang aking konting adjustment to the definition of prenatal care.
So now prenatal care involves the entire family.
I would like it to be that way.
Why is that? Why is it important to involve everyone in the family?
Because when the mother is taking care of herself during pregnancy, she needs emotional, psychological support. She also needs for the family to understand why the doctor is asking her to do this, why the doctor is asking her not to do this. So, medyo may konting interaction din ang family. So, in my office, I would like the father to be there or the partner to be there in order to be able to realize ano yung precautions, ano yung mga dapat gawin, ano yung hindi dapat gawin.
Okay. Doctor,
And
yes,
in
please.
pregnancy, it's always a partnership. And it's always a family affair. Especially pagka napanganak na yung bata, di ba? Ang dami natin sa Filipinos
Extended family.
Okay, an extended family. Huwag mong gagawin to, huwag mong gagawin to, ito ang gawin mo. So when you explain, especially with Dr. Ruaro as the obstetrician, she asked the patient to go to the pediatrician even before delivery. So we can talk on what to expect during delivery or after delivery.
In that way, everyone is prepared. In
Oh,
that way,
yeah.
the others remember what maybe the expecting mom doesn't remember during all of this.
It's like a team effort, not only among the doctors but the family members.
You mentioned there are things that one shouldn't do or an expectant mom shouldn't do and should do. So let's maybe run down that list. Yung mga
I have a very
do's
short
and don'ts.
list. It's very easy to remember. I only talk about 3 things. What should not happen during the pregnancy? One is the patient should never have vaginal bleeding. And this is pink, red, brown, black. Hindi siya kailangan palaging pula.
Okay.
So I advise the patient not to wear dark underwear so they're able to see if it's there. Number 2, they should not have abdominal pain. Dapat wala silang sakit sa tiyan, lalo na sa puson, kasi nandyan yung ating matres. And number 3, dapat wala siyang lagnat.
Okay.
Ang pregnancy is a heat-generating condition. Parang ang feeling ng pasyente palagi siyang mesena.
Yes.
So always have a thermometer ready kasi if it is 37.9 and above, you have a problem. That might be fever caused by some things that must be treated. Pero kung ang feeling mo mainit pero hindi naman 37.9, you know it's because of the pregnancy. Yung tatlo lang na yon, you'll be able to communicate with your doctor problems even early when they happen. Ano yung don'ts? Tatlo din. 1, no smoking please.
Okay.
By the patient especially, and never by the partner also. And sa mga bata rin, di ba Cynthia? Huwag silang makitang may sigarilyo na hawak ang baby because secondary smoking is as harmful as primary smoking.
And even the smoke inside the room, yung nakadikit sa wall, it's even worse. It affects also everyone.
My second don't is don't take any medications your doctor does not know about. Whether it is a prescription medication or a non-prescription one. Especially yung mga herbal. Yung may pangalan na natural.
Why is that?
Because these items are brought in as food supplements. And therefore, they do not undergo the tests that are necessary for medications to be proven safe for pregnancy. If you have a book, can I mention it? Yung book ng mga medications, my patients have that. Okay. Ikaw din, di ba? Meron na sila eh. May dala na sila niyan eh. Always look for pregnancy category. It will be A, B, C, or X. Pag nakita niyo yung X, never yang gagamitin. But of course, this is a communication between you and your doctor. The doctor should be able to say which ones are not allowed. One special mention, tretinoin. Very famous kasi ngayon ng skincare. Tretinoin is definitely contraindicated in pregnancy. They should discontinue this medication months before they expect to be pregnant.
Okay.
Meron pa ba akong number 3?
Number 3, yes.
Number 3, do not take care of sick people other than your immediate family because by the time nagkasakit sila, di ba Cynthia, nahawa na sila. So, don't go visiting sick people in hospitals unless it's absolutely necessary. Mga lola at lola, alam mo naman hypertension, basta walang infection.
Okay.
And be careful with the food you eat as well.
Okay.
Right? Do not eat raw food that's served in non-reputable
Is this all throughout the
restaurants.
pregnancy or just the
Yes,
first trimester?
please. You know why?
Oh,
You know
okay.
why? Because once you get infected with organisms that come from food that are not fresh, we will have to control that infection with medications. And the medications, how will they kill the parasites? They will poison the parasites. So how do we know if that's going to poison our baby?
And you have the baby inside.
Yes,
Yeah.
yes. We always have to keep that in mind.
have
That
to
there's
keep that in
another
mind.
human being inside
Yes,
of us.
always.
And I usually add the juices, the other food that they advise you to take. Not only the medications, but the juices, the supplementary diet. I mean, you know, unless it is approved by your obstetrician, I don't think you have to take it.
So what is a good diet when one is pregnant?
I have 3 again there.
Yes, yes, Doc.
First of all, don't think that by eating just fruits and vegetables, you are doing well. You're not. That's not healthy. Kailangan kayong kumain ng lahat ng bagay na nandyan sa table. What's important is you eat in moderation. Wag naman yung...
Kasi there's always this say that you eat it for 2.
And then you reason out,
Yes,
because
I'm eating for 2. I can
need,
eat everything.
And
But you have to count the calories also.
Oo. Number 2, you have to realize that there is a better way to cook food. For example, yung deep fried, yung breaded, I would rather they not select that over sinigang, nilaga,
Inihaw.
inihaw,
steamed, yeah.
stir-fried. Sige, allow na natin, Cynthia. Stir-fried, mabilis lang.
Diyos, Diyos ko, ang sarap.
What makes food taste good? Totoo yan. And then, sabi ni Cynthia, yung mga juices na yan, be careful. Especially when they are marked as sugar-free.
Okay.
Sugar-free. Because when they're sugar-free and they are sweet, they must have some kind of artificial sweetener. And right now, studies have not proven this as really safe for pregnancy.
Okay.
Okay?
Caffeine.
Hindi pa kami masyadong, coffee addict ako. As I said, moderation. Pero if you can have decaf, then good for you.
Why will you take the cup?
If you're a purist like the two of us, I might allow you maximum 2 cups
A
of
day.
brewed coffee, but please not concentrated. Allow mo na, sige na.
Oh, you have the coffee.
little
What
allowance
about
for
the
the
tea?
pregnant,
Because you have caffeine
Ladies,
also in the tea.
Always in moderation, sabi ko nga, because you don't want a pregnant woman who is unhappy.
Yes.
However, she must also realize that the safety of the baby is always important. That's why it's not always what you want or what you think is pleasurable to you, di ba? You must always think of your passenger.
All right.
Okay,
Happy
and-
and healthy pregnancy, a happy and healthy mom, of course. And
Less stress.
Meron pa ako
Baby.
number 3.
yes, please.
Instant food.
Ay, ang sarap magluto nun.
Instant food. The ones where you put hot water on, and then you put that small packet to make it really taste good. It's a lot of monosodium glutamate.
Stay away.
Okay, stay away from that. And then, of course, yung mga delata natin. Colored meat, Cynthia. Tocino.
May nitrites kasi siya,
Yes.
masama sa baby. And then
Yes.
yung dilata.
Even in moderation?
Yes. Well,
You have other choices besides that. That's number 1. Number 2 is you have to consider also coming from the can, the lead content of the can. And it affects also the child inside your womb.
Okay, so fresh doesn't necessarily mean it's also healthy.
that's not fresh. Canned is not.
well, the
fresh
earlier,
food.
yes.
Okay, fresh food. If you want to eat salads, please wash the vegetables well. And then be careful with the mayonnaise. 1, it's very, very fatty. 2, you don't know how they prepare it. So it's a matter of choice.
Okay. And here we've talked about the do's and the don'ts. We'll talk about more about that and maybe exercise also and
Vitamins.
Vitamins. But first we have to go to our Facebook question. Doctors? Angela asks, I'm pregnant, but I want to continue exercising. Oh, we were just talking about this. Is that still possible?
Yes.
Definitely. But, there are things you have to watch out for. Number one, ang question ko, were you really exercising before you got pregnant? If you were not, why will you start now? And if you're an exercise buff, sure you may, but no new exercises and no intensification of your exercise, not during pregnancy. Okay. Then meron din kaming mga guidelines about when it is not good to exercise, when they have complications of pregnancy like premature labor, vaginal bleeding, etc.
Hypertension.
Yes. Now, when you're exercising, you have to be really hydrated. Babies don't like high temperatures, right, Cynthia? So, you must hydrate. Therefore, your temperature must not be, as I said, 37.9 and above.
Hindi ka dapat nag-iinit.
Okay.
Bigay din na mainit
Sometimes, merong mainit na okay. Merong mainit na okay.
later on.
Meron ba? Oh my gosh. Okay, and then number 2, your heart rate. Okay? The heart rate must not be more than 140 per minute. But when you are feeling faint, mahilo-hilo ka na, huwag ka nang mayabang. Stop. Okay? Mahilo-hilo ka or nanghihina ka or you feel your heart beating. Tawag palpitations. Then stop. Ang isa pa, do not have abdominal exercises, especially after the 3rd month of pregnancy. The moment the hump on the abdomen comes out, please do not do your abs. As if naman. Yung mga abs na exercises, please avoid those. It's not safe.
So what is a good exercise?
Okay, good question. 1, walking. 2, slow running. Low impact aerobics. You can go on the tawag doon, Cynthia, hindi kasi
Step, like a stepper?
yeah, 1 step, and then the, ano ba yung gumagalaw?
Treadmill.
Treadmill.
Halatang hindi nag-exercise. Treadmill.
You can go around the block.
Yes, walk
How about
briskly.
dancing?
Yeah.
Yes.
Pero hindi lang masyadong high impact.
I am going to tell you that there is what we call sayaw sayuntis.
Sayaw buntis.
Meron siyang, this is from Dr. Faye Cagayan. Hi, Faye.
Hi, Faye.
Merong mga program ng belly dancing for pregnant women. So, you may ask about this. May program na ganyan. And she published a book. Okay, but taking care that the precautions are attended to. Yung sinabi kong mga precautions. At pwede kayong mag-costume.
That's the best part. It's
Belly
cute
dancing.
if you're very belly dancing. You have a
But
little
be
baby
sure
there
that hindi
that's belly.
tumitigas ang tiyan mo, ah.
Yes,
yes.
yung mga precautions na yun.
Okay,
You have to be cleared by your doctor. Of course, for you to do any kind of exercise. I forgot. Slow bicycle, stationary bike. Pwede rin yan.
Okay.
But only up to a point, ha? Huwag naman yung sabi kasi ni Dr. Ruar,
Pwede
pero
mag-bicycle.
37 weeks na.
Yung exercise.
About to give birth and you're still on that bike. Doctors, we have another question from Twitter, this time from Fatima. I'm 6 months pregnant now. Is it safe to have a massage?
Anong klaseng massage?
Right. Which parts of your body?
nga, no?
And then, there are different kinds of massage. And the worst one that I know is something where they bend you over and, you know, you get to be like a contortionist.
Like a pretzel.
Yes.
Pero kung sa ulo lang namang minamasahe
back.
ka,
feet,
or sa
foot
foot,
massage, pwede yan.
the daddy,
Back massage, shoulder, please keep away from the abdominal area, okay?
the daddy can do the foot massage. That's gonna be fine.
Oo nga, no? That's a partnership that we talk about.
Correct! Para naman may papel, no?
Makahawak mo na siya. Ang key dyan is the title of this very popular series, di ba? Be careful. Always, be careful.
Okay. And in being careful, we also want to know how much weight is ideal for a pregnant lady to gain.
It all depends what weight you started with. Okay. So now,
Let's say, kunyari, let's say 100 para buo
Uy,
yung
okay,
number.
okay,
Let's
okay.
say
It's
100.
not only the weight, it's
Okay.
also your height.
Okay.
So you must have in your office the body mass index chart. And it tells you by numbers comparing your weight and your height, whether in kilos or metric or whatever measurement.
English measurement in
Kung
pounds.
ano mang measurement yon, ipa-plot kayo, and then the doctor is going to see whether you're underweight, normal weight, overweight, or obese.
Okay.
And then we compute from there how much you can weigh, how much you can gain. It's safe to say the patient, okay, in my practice,
Yes.
I make things very simple. I go, you can gain 2 to 4 pounds per month.
Okay.
That's about a pound a week. But it all depends on where you are in that graph.
Yes.
So if you're more in the underweight side, then I can allow you 4 in a month. But if you're overweight or obese, medyo kailangan mo lower in the range. All right? And then you go month to month.
Is it because others, when they feel that, you know, they're about to give birth, it's a good excuse to just keep eating or to add to that 4 pounds? Because you're just about
I'm not going to make them unhappy, but I always tell them when the baby is born, the weight stays with you.
Okay.
And who's going
Alright.
to lose it? Not I, you.
Okay. So, and that becomes another entire topic here on MedTalk. But doctors, we'll now talk about what happens when this expectant mom gives birth. How do we care for the baby now when MedTalk returns? The ba-
Did you know that touch is one of the baby's most advanced senses at birth? Even premature babies born as early as 25 weeks are aware of being touched. A baby's sense of touch develops from head to toe. The mouth is the first region to become sensitive. That's why babies put everything in their mouth.
We're back here on MedTalk. After talking about mommy care, we now go on to baby care. Doctors,
Okay.
now let's talk about baby. You know, after carrying another
And
human
he-
being in our bodies for 9 months, now it's time to bring that human being out into
very
this
nice.
world.
Yeah, it's very nice to talk about babies because after we attend to deliveries, and especially now in Manila Doctors, we practice the essential newborn care. And when we practice that, and it's a DOH, WHO, UNICEF concept, and rules, Republic Act, executive order. You know why? Because we want to reduce the mortality. We want to produce beautiful babies, healthy babies. One is when Dr. Ruaro delivers, we dry up the baby very well, and we talk to the mothers about this during the prenatal period, during mothers' classes. So we dried up the baby. We give the baby to the mother, to the tummy of the mother, so there's going to be a skin-to-skin connection already. Number 3 is we delay the cutting of the cord. Number 4 is we put the baby near the breast of the mother so we can start breastfeeding. And breastfeeding is the best way we can help the baby and the mother.
Why you mentioned the delay of the cutting of the cord? Why is this delayed?
We have to delay the cutting of the cord para to help the baby make use of what is the blood inside that cord. So capitalize the advantage of having that cord there. Until it stops pulsating, that's where you cut it.
Oh, okay. So you also have to monitor the
Yes,
the
we monitor it very well, and that's we do in Manila Doctors. So that's one. And then when we have the baby already with the mother, we put them in the recovery room, and then we put them together in their room. So it's a mother rooming in already. We do not put them in our nursery. We do not put them in our NICU unless the baby is sick. unless the baby has some form of hindi makahinga, nahihirapang huminga, may
Maybe
some
jaundice.
congenital anomaly, the jaundice will come later. If you have an early jaundice, that's a problem. Now, that's what we do with the baby. We give them to the mother, and I have a mother who is having a blood transfusion and having the baby breastfeed.
Oh, that's
And
okay.
that can happen. Kasi the initial milk of the mother, which is the colostrum, yung pinakamalapot na tinatapon nila, akala nila ay, kasi kulay gold siya eh.
Akala nila madumi.
Hindi siya kulay puti, akala niya madumi. Nandun lahat ang antibody to help the baby. Kasi pag tinulungan mo yung baby, hindi siya madaling mag-infection. Hindi siya madaling magtae, magkasipon, magka-ear infection, magka-pneumonia. So that's what we do with the baby.
So that's parang the antibodies na
Yes.
bibigay ng mom to the
Oo.
baby.
Ang susunod, the next question is, when do you take care of the
Yes.
baby? Kailan siya nagkakaroon ng first bath? Not after the 6 hours. Kasi ayaw nating tanggalin yung natural protection ng skin niya. Di ba maputi yung sa kanyang skin na ganyan, coming
Parang may
inside the
film
womb.
pa eh,
May
no?
film.
Yeah.
It's not because may ginawa sila kaya nagkaroon ng film.
film, okay.
It's the vernix.
Okay.
It's the vernix. Hindi naman to triple. Hindi. It's the vernix that helps the baby not to have a yung mababa ang temperature.
Okay.
So that's to keep the baby safe and warm. Okay? So after 6 months, and we take the bath, we bathe the baby inside the room.
Inside the room also?
Inside the room already.
So is it safe to, when one gives birth, when a woman gives birth, when a mother has her baby inside the room, rooming in, a lot of, relatives, friends want to drop by. And syempre yung mom, sometimes she's wary of infection. Or
That's the
someone
problem with
sneezes or someone has a
Filipinos.
cold.
That's the problem with Filipinos. But since we are doing the prenatal,
Okay.
we ask them to reduce the number of people visiting in the hospital. And then no touch. The baby should not be touched, and there should be hand washing and alcohol. Okay, and then nobody will come in with colds. But if you have a cold and you're breastfeeding and you got the colostrum, the first milk, hindi magkakasipon ng baby. Not until after 4 months, 6 months. Yeah.
Okay.
And then, ang tanong pa, Doktora, bakit gano'n? Ang itim ng dumi niya. Bakit gano'n? Nagpupupo siya ng 3 to 4 to 5 times a day. Good, because you're getting all the milk, you're getting all the nutrient from the mother.
Okay.
Then, how to take care of the baby? Doktora, what will I prepare?
Yes.
What will anong layat na bibilhin ko? Siyempre, kailangan mo ng shirt. And then, I would advise the shirt without the tali. Kasi the tali, umiikot sa kamay ng bata.
Okay.
And then, you should have socks, you should have the diaper, and the mittens. The mittens, kung para hindi lang siya ginawin. You have to cut the nails. Kami nagka-cut ng nails sa hospital. Kasi kung mahaba na siya, kasi nai-scratch na yan eh.
Yes.
Ang sabi ko lang dyan, the lola is not cutting the nail because malabo ang mata niya, ang liit-liit niya. So they wait for about 2 to 3 months before to cut the nail. So you have the mittens, but that's bad.
So you do that in
We
the
do the
hospital.
cutting.
Okay.
And then, we do the cutting and then siya, give them the nails. And then yung pusod nila, anong gagawin? Nothing. Leave it alone. It will heal
Put
by
in the
itself.
baby
And it's just gonna...
And there's evidence-based said that
Falls off.
you just don't have to put alcohol. All you have to do is just leave it that way. Do not cover it, do not put anything. And then, bawal na prepare mo ang baby oil.
Okay.
Bawal din i-prepare mo yung mga
Cologne.
cologne will just be fine sa labas, but not in the skin of the baby. But you can have the lotion.
Okay.
Pwede yung i-lotion kasi, especially yung ganito ng baby, nagda-dry up siyang masyado, nagkakaroon ng rashes.
Okay.
So you can put lotion, but not on the hands. Okay? Ang isa pang bawal na bawal is powder.
Okay.
Kasi yung powder are just like silicone. Talc kasi siya. It goes to the lungs and it doesn't get out of the lungs. It becomes a foreign body. So you don't use the powder. Eh, doktora, pinapawisan, etc. You don't need the powder. You don't have to cover it. Mabango, di lagyan mo cologne yung gilid.
Okay, but not directly on the
Not
infant.
directly on the
Well,
baby. What else? You were mentioning about jaundice. Naninilaw talaga ang baby because the liver is immature. So what do we do with jaundice? First, 24 hours problema tayo. Baka type O yung nanay, yung type A, type B, or type AB, may ABO incompatibility. So mas madaming napuproduce sa paninilaw. So ginagawa lang namin, binibilad lang sa araw.
Okay.
Because yung sunlight kasi is, di ba you have the rainbow, then the 7 colors, so you have the blue light. The blue light from the sun have a chemical reaction and the yellowing of the baby and the skin. So, the first 3 millimeters ang reaction. So, pag tinamaan na yan ng araw at kinula mo na yan, naku-convert yan into water-soluble na iihi. Pero pag hindi mo yan, iniwan mo yan at tumaas ng tumaas ang paninilaw ng skin, it goes to the brain because it's fat-soluble. So all you have to do is convert it to water-soluble para maihi.
Maihi na yun.
So how do you do it? First thing is 1 hour, 2 hours bibilad sa araw, and then nakatihaya, nakadapa. Para mo siyang ikinukula. Hubad lang siya.
Okay.
Okay, so that's jaundice for you. But first 48 hours, okay lang yan, 72 hours. Now, how do I know if my baby is feeding very well?
There you go, doctor. You mentioned feeding. We have a question from Facebook. From Jessica. After feeding, how important is it to make my baby burp?
Pag nagbe-breastfeeding ka, you don't have to burp. Tulog na nga yung anak mong ganyan, igaganyan mo pa siya para mag-burp. Gigisingin mo na naman siya, iiyak na naman siya. Ang tanong dyan is, you don't need to burp pag nagbe-breastfeeding ka. Kasi tamang-tama lang yan. Tsaka nagbe-breastfeeding ka, relax na relax. So, a colicky baby comes from a colicky mother. If you're so relaxed, your baby is relaxed also. If you're so anxious, your baby is so anxious also. Colicky din ang nanay mo. Or not necessarily, kung si ama na siyang nag-aalaga ay colicky or kaya anxious, colicky din si baby.
Okay.
So relax lang.
So maybe to relieve the colic, relieve the stress, one must listen to music. Just like our Facebook question from Serena. Can listening to music really help in a baby's development?
May study sila na when you listen to music, basta it's an organized sound. Even inside the womb, pwede kang mag-listen sa music. Because it's an organized sound that your brain is getting used to. So magaling ka daw sa calculus, magaling ka sa math. Okay, so there's some help in it. Kahit na rock music, soft music. Pero yung sinasabi nilang, manonood ka ng manonood ka ng TV.
Yes.
For example, merong mga show na mga DVD na ganyan. Huwag naman kasi American Academy of Pediatricians says, no television, no tape, no anything 2 years and below.
Okay, but in watching MedTalk, one learns a lot from
Yeah,
how to
while
take care of
breastfeeding,
while
while
breastfeeding,
breastfeeding.
take to care for the baby, and for the mom also to take good care of herself during pregnancy.
Correct. Ang isa pang ayaw natin, and I want to, kalimutan mo na lahat ang sinabi ko about the baby. Don't let television be the background in your house. I mean, nagbe-breastfeeding ka, may ginagawa ka, nakabukas ang television 24 hours. Kawawa ang baby, let the baby rest in a quiet place.
May I say something about iPad?
Oh, yes.
Okay, Doc.
Because this isolates the child.
Hindi lang yun.
Mga 1 to 2 year old, they bring them to my office, naka-iPad sila. Mga bata, playing games.
And they do not talk. They have a
We must
delayed...
encourage them to talk and use motor skills for something else.
No motor skills, no exercise, no talk. Bingin na sila. I mean, I have patients now this summer who are very anxious talaga na, ay, kailang nanggigil na ganyan. Kasi they want to beat the iPad.
And you know what, doctors, how I wish we could continue our conversation. Maybe we can have a part 2? Yes? Yes?
Sure.
Yes? Okay. Well, thank you very much, doctors. We've learned so much in caring for a pregnant lady, a pregnant woman, and of course, caring for the baby that she has carried for 9 months. Again, I'd like to thank our doctors Marilyn Ruaro and Dr. Cynthia Huico for sharing their knowledge on pregnancy and baby care. See you again next Tuesday on MedTalk as we talk about kidney ailments. 10 p.m. on your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.